So my name is Samira. My background is really kind of community development, community engagement, and really looking at developing social movements. Essentially, by definition, I'm a community organizer, but I've worked in the NHS, in local authority, in the community and voluntary sector for over 20 years, and I'm working independently now. Still doing the same job, but essentially just working independently. I suppose I suppose my role has always been in that space between system and community, because I really think that's a really critical space. I used to define it as a tightrope, but actually it's becoming more of a chasm, which is a positive thing because lots of people are joining that space to really kind of begin to think about how communities and systems come together to really make sense of things. So the one thing that I always do, I'm a community development worker by background. I'll say always start with conversations with communities and frontline staff, because if the challenges exist in those communities, then the solutions lie there too. So how do we actually kind of create the space and nurture those spaces and actually kind of enable and facilitate those spaces to really help us actually develop things? The second, people at grassroots do integrated care really well. So what can we learn as a system and observe from those conversations and the way they do things and carry things out? I mean, one of the best examples is on Nieka, who's a community champion and community organizer. And when I asked her, well, why are you involved in the community champion? She said, there's one purpose, and that purpose is for my community to be the best that it can be. Well, as a strategy, if you think about it, that's the best way of actually articulating and defining what a strategy is and what it does. So in terms of clarity of purpose, if we start from that conversation, it really helps us to move to the next stage. What I don't do, I think there is something what I wouldn't do. There is something about the type of conversation, or if you like, the elephant in the room about ICS strategies and narratives that speak to integrated care and really actually kind of bringing services and bringing organizations together or pulling budgets together. I think there is something about the strategy. There's the reality of the narrative of the strategy and the reality of what happens on the ground. Organizations do play to their kind of own silo way of working. There's kind of so many cultures within cultures within cultures, and you can't really actually kind of, unless you begin to address that, it really kind of makes it really difficult to do. And it frustrates the whole process of actually really thinking about how we can develop and deliver integrated care. A brilliant example of Justin, so Justin is, he's a volunteer. He volunteers in the drugs and alcohol service. And I was having a conversation with him, and he said to me, you know what, as a volunteer, I'm going to do what I'm going to do. And I don't care what anybody else says. And it was very much about the services in terms of how his role as a volunteer working in a drugs and alcohol service. And Justin knows about drugs and alcohol. He was a drug user from the age of 13 to the age of 43. And then he says his way of giving back is actually by working with people and community. He knows what works and doesn't work. And he says, I don't care what they're going to do. They're going to, they can't sack me. I'm a volunteer. I'll go and do something else. So the idea then, how do we actually nurture people like Justin to really kind of help us make sense of what happens? So I think there's something about really how do we address the different cultures within our organization. So when we're talking about an ICS strategy to address health inequalities, we're talking about something else. Just kind of one final point. We were in the very early days when it was still called accountable care organizations. We were kind of doing some community conversations about how do we, and the definition then was very much about pulling budgets, bringing services together and integrating organizations together. And there was a blank look amongst quite a few of the people that I was facilitating conversation with. And I said, so what is the issue? And they said, well, that's your job. Go away and do it. You know, if you want to pull budgets together, you want to integrate services, do it. That's your job. Why are you asking us? But if you want to have a different conversation about actually really a different way of thinking based on people, not structures, based on activities, not outcomes and processes, that's a different type of conversation. And we're happy to do that, and we can help you around that. But we can't help you with pulling budgets together. That's your function. That's your job. So what is it? What type of conversation we have with communities is really quite important and critical. But also how that manifests itself in our systems, knowing and understanding that our structures are actually quite rigid in the way that they actually kind of operate and actually kind of develop. So I'll just stop there.